Hey, in this video, I'm going to be answering a question that I got from one of our subscribers as a comment to our other videos. And they asked, should I be using a knee brace like this one when I exercise? My name is Dr. David Midoff, and I'm a specialist physical therapist. And on this channel, we help people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please consider subscribing to this channel so that you don't miss out on any of the helpful videos we post every week. So to answer the question, should I be using a knee brace when I exercise? The answer is it depends. Sometimes it's appropriate to use a knee brace. Other times it's not. And it's not a matter of comfort because it's always going to be uncomfortable to wear a knee brace. As far as it sliding down your leg and possibly pinching the back of your knee, it might feel more comfortable in that your knee might hurt less, but it's always trouble to be sliding that knee brace up your leg as you're moving more throughout your workout. So to give you some clarity on whether or not you should be using your knee brace is you have to think about what point in your knee problem are you. If you just got hurt or you just began to have knee pain and you found out that wearing a knee brace helps you to feel better, then you absolutely should be wearing a knee brace while you're exercising. You should allow yourself to heal all the way. Sometimes that takes a few days to a few weeks, depending on your injury type, what's going on. And as long as you can begin to wean yourself out of that knee brace and you feel better as you do so, then you're good to eventually get rid of the knee brace. If you have a more chronic knee problem, like this has been going on for months or even years or decades, then you're going to be in a different situation. There's likely an underlying root problem that led to your chronic knee problem, and that needs to be addressed in order for you to successfully exercise without pain in your knee. Now, if you've been wearing a knee brace like this, or even a sleeve that doesn't have, the brackets, this one has the metal brackets and protects you to bend correctly. No matter the type of knee brace you're wearing, if you've got chronic knee pain and you found that it feels better to wear the brace when you exercise, then continue to do so. But understand that you have got to be fixing the underlying root problem for your knee issue in order to eventually wean out of wearing the knee brace. Now, for most people, they usually have weak glute muscles, weak butt muscles, and their quad muscles in the front of their thighs are overdeveloped, and that's what's causing excessive compression at the front of the knee joints, and that's irritating the cartilage or damaging the meniscus, and that's what set up that chronic knee problem. And if you're taking care of it, you're doing treatment or you're doing exercises to get stronger in the glutes or the right muscles, depending on your specific situation, and you felt more comfortable outside the knee brace as time has gone on, then you can begin to look at times where you can exercise without the brace. But if you're still not sure what's going on, you don't have good control, you don't have a handle on improvements in your knee problem, then you might want to stay in the brace a bit longer until you do so. Be sure to wash your brace. If you're exercising, you're getting a little sweaty, these things can get a little smelly. I would wash it every day or every couple of days that you have it on, depending on how much you sweat and the type of weather that you're in. If it's hotter, you're going to sweat more, of course. You're going to want to wash that more often. And I would even get a couple of braces, maybe one that's just for exercise and one that you might wear outside of the gym or outside of your exercise time. If you're thinking about getting a brace and you don't know which one to get for your specific knee problem, I've linked a video in the description below that tells you how to shop for a knee brace depending on your specific knee problem. And just to recap what I said here, if you have a more acute injury, meaning you just started having knee pain within the past few weeks at most, and you found that wearing a knee brace helps you out, then you can begin to gradually wean out of it as long as you feel comfortable to exercise with the knee brace. If that's what you've been doing, then you need to start to get yourself out of the knee brace. Now, what I didn't mention earlier is the harm in staying in the knee brace for too long is that it can change the way that your knee joint moves. It can change the way that your overall movements occur, and certain muscles might adapt to using the brace, which could make other muscles weaker, and it could just cause problems in the long term. So you only want to really use this knee brace at the beginning of an injury, ideally, if you just got hurt or started to have knee problems. You've got to eventually get off the knee brace and learn how to exercise without the knee brace so you can get back to normal again. And then if you've got more chronic knee pain, if you've had this problem for months or years or decades, and you've been wearing a knee brace to get relief in your knee problem whenever you go exercise, you should not get out of the knee brace until you have a successful plan, you're seeing some improvements in your knee problem because you're addressing the root problem, then you can confidently get to the point where you're weaning yourself out of your knee brace and not relying on it for the long term. Now, again, it is dangerous even in that situation to rely on the knee brace for the long term. If you feel like you've been wearing a knee brace for months or years and you're not really sure when you're supposed to get out of it, or you're not sure if you're improving or not, I would highly recommend going to go visit an expert nearby or watching more of our videos to learn more about how to treat your own knee problem and get improvements in your knee so that you can fix the problem for the long term. I've linked a playlist in the description that has all of our YouTube videos for knee problems, and there's specific knee problems like knee meniscus issues, knee arthritis problems, and more linked down in the description below, so go check those out. Hey, if this video was helpful for you, give us a thumbs up and drop a comment below if you've got any questions. And please consider subscribing to our channel. We make videos focused on helping people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and medications. We'll see you in the next video, guys. Bye-bye.